Good afternoon, everyone, and welcome. Thank you for joining us for today's presentation. We have over 100 HR professionals from a vast range of industries. Many of you are clients. We speak many times a day in some cases. I'm happy to see a lot of familiar names on the list. I'm Tricia Riley. I'm the chair of the Labor and Employment Group here at Murtha, and I have with me presenting today Matthew Curtin and Sal Gangemi. We will be talking to you about managing the COVID-19 pandemic in the workplace. This is part two. Part two because we've all already been through the trenches in a little over a month. It seems like it's been forever, doesn't it? And now, amazingly enough, many of us are looking forward to return to work. Some of us I know on this call have never stopped, and we've been in contact with many of you about the essential functions and continuing to keep workers in the workplace. Some of you have closed your doors and are looking to reopen. In terms of logistics, all callers are in listen-only mode. The good news I have to share with you today is that we hope to take questions at the end of the presentation. Unlike last time where there was so much information that we had to present, we couldn't get to the questions. We're hoping to be able to get to some today. And of course, you all know where to reach us if you have any questions afterward, and we'll be happy to speak with you. This webinar is being recorded, and all of today's participants will receive an email following the presentation with the PowerPoint slides and a link to the webinar recording. So let's begin.
Hi, everybody. This is Matthew Curtin. We're going to move on to the slide with our pictures, and then you can at least see who I am, and you can see Tricia and Sal as well. So if you can advance that, that would be helpful. So let's talk about the agenda for today. The agenda really is what is happening and what happens next. What is happening is the question that I'm asking myself every day because I cannot keep up with what's going on with the employment laws, with what is happening with our various clients. It seems like it changes not only on a day-to-day basis, it changes on a hour-to-hour basis, where we'll be advising on one issue and we'll seem to have guidance from the EEOC or OSHA or CHRO, and then it just seems to change within the next hour. And that it's been rolling guidance coming out from different administrative agencies that sometimes is contradictory, sometimes it's difficult to understand, sometimes it's just flat out wrong, and these agencies are correcting themselves. But like everybody else, we're doing our absolute best to keep up with it, to keep our clients compliant, and to mitigate risk as we move through this pandemic. But I know that, and speaking with lots of you on the call, it has been a real challenge. Everybody uses the word unprecedented, and that's absolutely true, and I hope we never have to go through something like this again. So that's the what is happening, and then we're going to talk about what happens next. Word of caution, everything that we say today could be different by Monday because, like I just said, it keeps changing. So Sal and I and Tricia were revising this PowerPoint up until the last hour, trying to make sure that we had the most recent guidance and the most recent news updates in here, and just to understand it ourselves. So we'll talk about what happens next, but that's going to be a lot of that's going to be a case-by-case basis, because as Tricia referenced, some of you as employers are essential employers and you have employees at a physical workplace. Some of you don't. Some of you are completely teleworking right now, and that might not change anytime soon. And some of you are somewhere in the middle, where you have some employees at the physical site and you have others that are teleworking. So we'll talk about how we're all going to approach return to work on a case-by-case basis, and some tips and some issue spotting for managing through the pandemic and through the return to work process. So we're going to move to the next slide, give you a little bit of context on the timeline. So I think it's been about a month since we last spoke with everybody on the call, at least in terms of webinar. So we thought it was a good time to update everybody. Last time we focused pretty heavily on FFCRA, and we started to talk about CARES And we've really focused heavily on the technical aspects of FFCRA and CARES. And I think a lot of us, we're starting to get our heads wrapped around that now. We're starting to understand some of the nuances of those different phases of the stimulus relief. So we thought it was a good time to just circle back with everybody and talk about where we've been, where we are, and where we're going. So to give you some context on the timeline, what are we here? It's May 1st, so that's a nice guidepost. We're at May 1st. The pandemic really was declared a pandemic on March 11, 2020. We started to have some knowledge about potential coronavirus in February, maybe even somewhat in January. I don't think we started to really get scared about it until the last week of February and the beginning of March. And so then in the beginning of March, on March 6th, the federal government implemented what it called phase one of its stimulus efforts, and that was the Coronavirus Preparedness and Response Supplemental Appropriations Act. That was really, in summary, an $8.3 billion spending bill for coronavirus vaccine research and development. And as we all know, that's underway, and hopefully we're making great strides towards that to develop a vaccine and potentially a cure for the coronavirus. But that's ongoing. So that's March 6th, not that long ago. March 11th, COVID-19 declared a pandemic by the World Health Organization. And that's really when everybody started to shift into overdrive on what do we do, what is happening, pulling out our hair, and we were off to the races. March 18th, only a week later, phase two of the stimulus plan was the FFCRA, Families First Coronavirus Response Act. We detailed that in great length at our last webinar. And I know we've counseled many of you through the nuances of implementing FFCRA. So we're not going to focus on FFCRA all that much today unless we get into it in the questions. And then phase three was the CARES Act. That's phase three of the federal stimulus response, and that was March 27th, 2020. And then phase four, which is not on here, but phase four is the more recent federal act that basically supplemented a lot of funds that were appropriated under FFCRA and CARES, because I'm sure as many of you know, many of the grant and loan programs under CARES quickly were exhausted. It's my understanding now the PPP loans, which I know a lot of you have applied for, those were quickly exhausted. Money under phase four was appropriated to supplement the PPP program. Those PPP loans are available again and to a certain limited extent. We're not going to talk about the PPP loan program in any great detail today, but for any entity that has not applied and you're on the fence about it, or you think that you might, get your application in as soon as possible, because that money is going to run out again very quickly. And I don't know if there will be a phase five. Probably, but right now there's no discussion about that, at least any serious discussion. So that's the timeline of how we got to May 1st. And to give you a little bit more context on the next slide, where are we today? Well, the last time we did a webinar, I showed you a slide with a graph, a bar chart that detailed the exponential explosion of initial unemployment claims filed in the weeks leading up to that last webinar. And it detailed that since the federal government has started tracking initial unemployment claims on a week-to-week basis in 1967, it had never gotten above maybe 500,000 or 600,000 claims on a national level in any given week, even during previous recessions. And in those weeks leading up to our last webinar, there were millions of initial unemployment claims on a nationwide basis. No surprise, hasn't gotten any better, keeps getting worse. It's going to keep getting worse. The Connecticut unemployment rate for the week ending 4/18, which is the most recent data we have, was at 18.51%. That's up from about 2.5% at the middle of March. So that's a huge explosion in a very short time. in the unemployment rate in Connecticut. More than 430,000 initial claims related to COVID-19 since March 13 in Connecticut alone. New York, not much. It's not much better, but 13% week ending April 18th. More than 1.4 million initial claims related to COVID-19 since March 13th. And then Massachusetts, the unemployment rate is worse than Connecticut, 20.4% week ending April 18th, and more than 570,000 initial claims related to COVID-19 since March 18th. So that's just to give everybody some context of what we're looking at. It has not gotten better. It's only going to get worse with unemployment claims. Luckily, the government has implemented these 4 phases of relief, but I know that for some of us, it's helpful. For some of us, it has presented only more headaches. So we'll talk about some of that today. So going on to the next slide, we're going to talk about just some background on the mechanisms and the procedures of unemployment benefits that are being doled out under CARES and FFCRA. Some of the more recent guidance that we've received is that self-employed individuals and contractors can now file for UI benefits if they're impacted by coronavirus. Generally, as most of you probably know, usually self-employed individuals and independent contractors are not eligible for unemployment insurance benefits, but under CARES, federal government's appropriating money to try to take care of those individuals that are impacted by coronavirus, and that's under the Pandemic Unemployment Assistance Program under CARES. Important to know, the Pandemic Unemployment Assistance Program apparently is up and running in Connecticut, in New York, and Massachusetts. As of April 30th, the $600 supplemental UI benefit under CARES is now available apparently, and that will be paid out now going forward and retroactively to individuals that were otherwise eligible for that $600 supplemental UI benefit. The Department of Labor has instructions on its website of how to claim those benefits. So that's not really focused on the employer, but to the extent that anybody's interested in that or wants to point their employees in the right direction, tell them to go to the Department of Labor website in Connecticut, New York, or Massachusetts as applicable. And those various jurisdictions have continuously updated their guidance on how to obtain unemployment insurance benefits under these circumstances, whether it be the additional $600 weekly benefit or the extended benefits. One other issue that I thought I'd just raise, because I've had a lot of clients calling me about it this week and asking about the issue of direct reimbursement employers, which generally are government. In Connecticut, it's government and nonprofit and tax-exempt organizations. One issue was that under CARES, there would be a 50% reimbursement of UI claims for claims made between March and December 2020 for those direct reimbursement employers. Recently, the federal government came out with guidance that says that that direct reimbursement will come later, that those reimbursable employees are going to have to pay the full value of these UI claims between March and December 2020 before receiving reimbursement. Most of these direct reimbursement employers, I think, were hoping that they would just get a bill for 50% of initial UI claims so that they didn't have to wait for reimbursement. It's not happening. The federal government's going to make you pay that out. And then down the road, there will be a mechanism in place for reimbursement of that 50% of UI claims for direct reimbursement employers. What's the upshot of that? I think that that's really going to impact small to medium-sized tax-exempt organizations that pay on a direct pay method, because it might be the case that they don't have set aside the type of reserves that are going to be necessary to pay the bills that are coming for these huge amounts of initial unemployment claims. So that's going to be a burden on smaller tax-exempt, medium-sized tax-exempt organizations that don't have a reserve set aside And that's something we're going to have to figure out how to work through. But that guidance just came out this week, so we're still discussing that. But that's an issue I just want to spot for everybody. Next slide. This is a question that we're getting. It's a frequently asked question that we're getting from clients, and it's what happens. So this is an example. What happens if you offer a furloughed employee a return to work, but she refuses because she's making more money on unemployment than she would be working? What do you do? And we're getting this call from clients because now that some employers are returning to work or planning to return to work, the employees are saying, look, with this $600 supplemental payment, I'm making more money sitting at home than I would be working for you. So what's the incentive for me to come back to work? The Department of Labor actually addressed this on the weekly webinar this week. So they said that the basic upshot is going to be, if somebody's refusing to come back to work and there's suitable work for them, they had a job, they were furloughed or they were laid off, and now they can return to work, and the employer's making that clear to them on the same terms and conditions. If that individual refuses, they're likely not going to be eligible for unemployment insurance benefits going forward. I say likely just because I can't guarantee anything when it comes to the Department of Labor right now, but the Department of Labor has said that they actually have an email address, dol.meritrating@ct.gov, and on their webinar, they instructed employers to email dol.meritrating@ct.gov if employees do not accept an offer of return to work. The DOL is then going to take into consideration the circumstances and on a case-by-case basis make a decision whether to approve or discontinue UI benefits. So that's going to, but I think what likely is going to happen is that employees that refuse return to work are going to end up without UI benefits going forward and likely a job. So, it's going to, I think it will backfire on employees that refuse return to work because they're going to lose their benefits. And if they've refused their return to work, employers might fill that position in the meantime because there's going to be a lot of people looking for jobs. So moving on, Sal, Trish, do you have any comments on that?
No, I actually gave an employer that advice the other day before the UI webinar, where they actually told you to email the merit rating division. I think that's a very good piece of advice there. And the messaging is what's important. So if you have an employee who says, I'm not coming back to work, you can say to them, well, then we're going to report that there's suitable work available to the unemployment division, and you are not going to be collecting benefits. I mean, I think you can say that to the employee because the whole point here is to get them back.
That's right.
Right.
So we want to get people back to work, and we don't want them. Yep.
No, yeah, and I was going to say I had this issue yesterday as well, and I just want to point out that it certainly is an employer's obligation to report to the applicable Department of Labor when in fact this is the case. When in fact there is work available and an employee is unwilling to come back. Now the caveat to all of that is to make sure that the employee doesn't have a legitimate basis for refusing to come back. Because if the employee is otherwise falls within one of those categories of people who shouldn't be going to work because of a quarantine order or because of symptoms or the like, then that's something you absolutely need to take into account. That really relates to whether or not you should ultimately terminate them for refusing to come back when there's available work.
Good point. Or if they're sick. That's another issue, is if you offer to return them to work and they're sick and they have COVID-19 or they've been exposed to COVID-19 and they need to self-isolate, that might be a legitimate reason. But if there's no legitimate reason to refuse to return to work and it's just I'm making more on unemployment than I otherwise would working, that's not going to cut it going forward. So, and I think that will be the general advice in New York and in Massachusetts as well. We don't have that specific guidance in New York or Massachusetts, only in Connecticut, but I think that should be the same answer under all three of these jurisdictions. So moving on to the next slide, we have, we're just to point out some Connecticut issues, and I assume most people are familiar with this at this point, and we're not going to go into too much detail about it, but I just want to make sure that everybody knows that there are binding safe workplace rules for essential employers. That's per Executive Order 7B in Connecticut. The Department of the DECD in Connecticut, which per Governor Lamont's executive order, issued safe workplace rules for essential employers. So you can find that on the Department of Economic and Community Development's website. And we've detailed those rules on our employment law blog, and we've given some of our own thoughts on the employment law blog as well. So I don't want to go through all of those. I mean, a lot of it is pretty intuitive if you've been following the CDC guidance. Practicing safe hygiene in the workplace, eliminating non-essential workplace travel, requiring masks or cloth face coverings, and that was covered in Executive Order 7BB. Controlling contact between employees and other employees or customers. There's a lot of helpful tips in the DECD's safe workplace rules on controlling contact between employees and other employees or customers, eliminating transmission points, a lot of helpful guidance on that. There are specific rules and guidelines for construction site employers. There's guidelines on handling workplace illness, and there is also a different set of rules for essential safe store rules for retailers. So for essential retailers, they're open, and for the retailers we're about to discuss on the next few slides when we discuss the restarting of the economy, you should certainly refer to the essential safe store rules on the DECD's website. And even if you're in New York or Massachusetts, these rules, they're very broad and applicable to different jurisdictions. In Connecticut, they're binding, and I'll talk about that in a second. But just so everybody knows, if you were to follow these DECD rules in New York and Massachusetts, it would only benefit you as an employer because A, it's going to make the workplace safe. B, it's probably going to improve morale with your employees because they'll understand that you're doing your best to make sure that they are safe and taken care of. It'll probably increase operational efficiency as you reopen the workplace or return to work or start to return workers who have been teleworking. So these are all guidelines that you really should be implementing to make sure that you're keeping people safe, you're maintaining or even improving upon operational efficiencies, and you're maintaining positive employee relations. One thing I want to talk about with the binding nature of the safe workplace rules is Connecticut has made clear through Governor Lamont that the Department of Labor will do site checks. They're probably targeting larger employers, but the Governor Lamont urged employees who believe that their employers are not complying with the safe workplace rules to self-report to the Department of Labor, and there will be site checks. What the remedial mechanism could be, I don't know. There's still nothing out there about what kind of remedies there might be, but still, it's not worth tempting the government at this point. You don't want to have a target on your back. So we strongly urge all employers to implement these safe workplace rules. And one other thing on here is the CHRO in Connecticut, Commission on Human Rights and Opportunities, has extended the deadline for mandatory sexual harassment training in certain circumstances. And it's basically if it's impracticable to complete the training on a timely basis, and you have a good faith effort, you've made good faith efforts, but you can't do it, the CHRO is going to allow a 90-day extension. We still urge people, employers, to train their new employees or existing employees who haven't received training, train them as soon as possible, because I mean, the longer it goes without that training, the more opportunity there is for some sort of risk incident to occur. So this isn't something we recommend, is delaying the training, but this is more if it's impracticable. And remember, and the CHRO has made clear, they have their online training. It's not my favorite training module, but they do have that online training module that can check off the box for the compliance with the CHRO sexual harassment training. Also, if we can offer training on a case-by-case basis with clients, and you can contact us and we can discuss how we could make that happen as well. So those are some of the Connecticut specific issues. If we go to the next slide, Sal's going to talk about, we're going to talk about very briefly Connecticut's reopening plan. This is something that we just inserted in the presentation because Governor Lamont touched on this in his briefing last night. So some of you might know, May 20th, certain businesses are going to start to phase back in. That's kind of the deadline for that. That's when the social distancing and some of these guidelines start to expire, much like the CDC guidelines on the federal level expired as of yesterday. And as far as I know, they still haven't been renewed. So Governor Lamont said he has a 4-stage plan for restarting Connecticut's economy. The first phase is I'll show you on the next slide the graphic that he brought out, but it's going to concern some retailers that are not open right now. Some small businesses will be allowed to return, some outdoor restaurants, not indoor and not bars, but some outdoor restaurants will be able to reopen on May 20th. Phase 2 and 3, I have no idea what they are. I've tried to figure it out over the past couple hours, but it still seems to be kind of nebulous. Phase 4, also nebulous. All I got from Governor Lamont was it could be at least 10 months away for Phase 4, but there apparently are 2 and 3 and 4. But let's go to the next slide just to show everybody the graphic that Governor Lamont displayed yesterday at his news conference. And so he's got these 2 columns here, now and May 20th, and it concerns now some manufacturing is opening, essential retail, real estate, utilities, construction, childcare, hospitals. May 20th, restaurants will be outdoor only, no bar areas. Remaining retail that's not right now currently designated as essential will be allowed to reopen. Offices, we'll talk a little more about offices. Continue to work from home where possible. We'll detail that later. Personal services, hair and nail only, they're going to go back into business. Museums and zoos, outdoor only. Additional outdoor recreation is going to open up, and university research programs. I haven't seen anything like this in some other states. This seems to be pretty detailed compared to what other states have done. But that's the kind of bare bones plan that Connecticut has right now, and expect more detail on that. Could have come out within the last 20 minutes, and I have no idea because it's happening so quickly. Sal's going to talk next about New York State and Massachusetts.
Sure. So despite the supposed cooperation between Massachusetts, Connecticut, New York, and New Jersey, and I guess even Pennsylvania, there are some differences as far as the reopening plans are concerned. For example, in New York State, May 15th is the date that certain businesses will be able to start or to begin reopening. The governor has outlined a 2-phase plan for opening businesses in the state, but is treating the reopening differently depending on the region in the state. So, for example, upstate New York will likely be reopening first because the number of COVID cases in upstate New York is considerably less than those cases downstate. So, for example, New York City, Westchester, Nassau, and Suffolk counties will likely reopen later on. Between New York City, Westchester, Nassau, and Suffolk, you've got something like, 30, 60. You've got over 220,000 cases of COVID-19. And so it's understandable that downstate will open much later. The phase 1, so we said there were 2 phases. Phase 1 opening is construction and low-risk manufacturing. Now, unlike Connecticut, New York prohibited all manufacturing except for manufacturing in critical infrastructure areas. So manufacturing for all intents and purposes has been shut down in New York State. Low risk manufacturing is expected to open, as is construction. I don't know what low risk manufacturing is. I would imagine that it involves a manufacturing workplace where social distancing won't be an issue. Okay, and some other precautions will likely be able to take place. In phase two of the plan requires that more essential businesses and low-risk businesses will be able to open, but those haven't been defined. We don't know what it means. And so if you have people working in New York, or if you're working in New York, chances are you won't be able to get a haircut or get your hair done anytime soon, because it doesn't appear that those types of services would be included. There's no mention of a phase 3 or a phase 4, but I do suspect that is something that will have to happen. An important note to mention is that between the phases, there's going to be a 14-day waiting period so that the state can monitor the number of cases, COVID-19 cases that are showing up on a daily basis. New York State is still at 1,000 new COVID cases a day, so which is very, very high, which calls into question how quickly we're going to move from phase 1 to phase 2. And of course, there's going to be some multi-state coordination, particularly for New York County and the boroughs and Long Island, because those states or those counties are so close to New Jersey and Fairfield County in Connecticut. Okay, one thing that the governor did emphasize was that summer activities are a priority for downstate counties. The governor wants to make sure that that there are summer activities that people will be able to engage in, so that they don't completely lose their minds. So sanity is a priority. We can move on to the next slide. Okay, so Massachusetts reopening plan, the stay-at-home advisory is set to be lifted on May 18th, but we don't have any information regarding a plan to reopen. There was a reopening advisory board appointed, and they are expected to produce a plan to the governor by May 18th. So beyond that, we don't have any other information. Next slide. Okay, so what do we want to do? Everyone wants to return to work, okay? People are getting tired of staying home for the most part, and employers want to get up and running again. But the fact of the matter is that there's going to need to be a lot, that you're going to have to do a lot in order to get the workplace ready to accommodate employees or business as usual. There are going to be some engineering issues in terms of plastic or dividers that separate people from one another. Infection preventive practices are going to have to be implemented, and you're still going to need to be flexible. So Matt, Tricia, do you have anything that you'd want to add to that?
Yeah, I'm actually advising quite a few employers on this, and I've done a kind of high-level outline of the issues that we may want to look at. And the first is who, what, when, why, and how. In other words, who returns, why are they returning? You really have to think that through. So to the extent people have been able to work remotely, why are they returning? What's the business purpose for it? How do they return? Do you do shifts? How do you decide who comes back first? What kind of order do they go in? Transportation commuting issues. Is it safe for your people to return to work? Are the public transportation systems reliable? If not, do you want to consider some other mode of transportation? I have some employers who are considering employer vans for their employees. What is your responsibility as the employer versus what are the responsibilities of the landlord if you have a lease? And who's in charge of speaking with the landlord to ensure that all of those cleanliness and hygiene and safety precautions are in place in the building that you're leasing? Child care issues. Can people continue to work remotely if they have child care issues? Then the biggest categories are health and safety and privacy issues. And this is where the guidance and the world has really changed significantly for employers, because as we know, before the start of the pandemic, we could not take an employee's temperature. An employer couldn't do that. Now, the most recent EEOC advice says an employer can administer the COVID test. So the point here is that the world has changed, and there are significant issues from the high level of who's coming back, why, and how's that going to work, to very mundane issues like, are we going to close off the cafeteria entirely? And the answer is probably yes. So how are people going to eat? What is the mechanism by which they're going to be eating? Once they're on site, do they get to go back and forth? Are you taking temperatures? If so, what time of the day are you taking temperatures? When they first arrive, and then if they can't go out again, is that sufficient? Or are you going to let them go out and then come back, etc.? What privacy mechanisms are you putting in place to ensure that the temperature taking is as private as possible? What kind of mechanisms are you going to put in place for visitors? Are you going to still continue to shut down travel? So all of these issues, for those workplaces that have remained open, you have already addressed many of these things, and so it's not going to be a change. But for those workplaces that have shut down completely, the reentry, the world into which the employees are returning, looks very different from the one they left. And all of those things are going to have to be addressed, planned for, and put in place before there can be a return to work for employees. So let's talk specifically about the antibody testing as a condition to return to work. Can employers require? Yeah, go to the next slide, please. Can employers require antibody testing as a condition to return to work? They can. Is it reliable? That depends. We're hearing very mixed things about the reliability, and there are different tests out there. But as I just said, can employers test for COVID-19? Yes, they can. And again, I think this raises a lot of really interesting issues for the employer. I mean, it's one thing if you're a healthcare provider and you're testing for COVID-19, but what if you're just an office building? Who's doing the testing? Are they able to test reliably? Many companies that can afford it are looking into third-party contractors to do this. I've had a couple of different organizations inquire about some new technology that scans everyone as they walk in the door and takes their temperature. I don't know a lot about that technology yet, but this might be another mechanism. Again, you'd have to ensure its reliability and ensure the use of it confidentially. And also, if you're going to use that kind of, the minute you walk in the door, your temperature is taken technology, you'd have to have some kind of notices, posters to tell your employees and anyone who walks into your premises that they are being subject to this kind of monitoring. Discrimination issues, they can arise both with regard to the who you're testing. So, of course, if you're going to have a temperature testing, it should be everybody across the board. And the other issues are on return to work. If you're only bringing back certain employees. Obviously, there has to be a business justification and not an age-related justification necessarily. Although it's an interesting question, there have been requests for accommodation based on age, which is my view, unless they have a doctor's note saying they have a pre-existing condition that would make them more susceptible. I don't think that there's protection for age not to work as a result of just the statistical fact that it impacts older people more heavily. And I think the reverse in terms of the discrimination issue is that an employer cannot be paternalistic about it. You have to be careful. So if you think that an employee is more susceptible, because of their age or because of what you may know about their condition, you can't, say to them, you shouldn't come in or tell them not to work. You can, if you have options for people who don't want to work, and they can take advantage of those the same as anybody else, but you have to be tread carefully when you are making these return to work decisions and these kinds of accommodation issues. So let's go to the next slide,
Let's move
please.
to the next slide.
Oh, are we on? We are. Okay, we're on teleworking. So on the teleworking mandatory accommodation going forward, this is a really good question. So the fact is, prior to this COVID situation, many employers would say this job cannot be performed remotely. Well, now we've proved that almost every job can be performed remotely, except for, certain kinds of jobs that are public facing. But so the issue then becomes, how are you going to justify a request for teleworking if someone requests that as an accommodation? How are you going to say, no, that's not possible? It really does raise the standard of proof for the employer to prove undue burden for a teleworking request. And moreover, my view of this return to work is that the vast majority of the employees, as long as they've been productive working remotely, that the idea is many people are still going to continue to work remotely, if not 100% of the time, then for quite a large percentage of the time. And that's doable by scheduling. Certain groups only come in certain, if you want to do it by teams, certain teams only come in certain days, et cetera, or again, shift work. Matt or Sal, do you have anything to add to that on the teleworking prong?
Well, let's go to the next slide, because what you were just talking about really plays into the next slide. And so the next slide is talking about potential traps in return to work. And I think the biggest trap, from what I'm hearing about with colleagues around the bar and what I'm reading about, and just what I can envision, is inflexible employers. And I think you're going to have to be flexible as an employer going forward. I think that the employers that have weathered this pandemic the best from a management standpoint are the ones that are open to creative solutions, and those who are considering alternatives to the norm. And those employers that are not considering alternatives to the norm, just continuing to have business as usual, ignoring CDC guidelines, ignoring executive orders, and there are those employers out there. I think that those are the employers that have gotten in trouble. They're getting bad press. It's not just legal trouble, it's reputational harm as well. And I think flexibility is going to be a key. And so what Trish is talking about with teleworking, you have to consider alternatives going forward as we return to work, and even as we adjust. Best case scenario, that there's a vaccine for the pandemic in the very near future, and there's some sort of therapeutic treatment for those who have contracted it, and we can start to return to whatever normal looks like. Still, there's going to need getting back to where we were before probably isn't likely anytime soon, and we're going to have to maintain flexible human resources practices, not only from a legal perspective, but just from an employee relations perspective and from a reputational perspective. So you're going to want to consider rearranging work site layouts for social distancing issues, accommodating teleworking, Tricia said, add plastic screens to retail situations. When I went to CVS yesterday, there was a screen. When I went to Highland Park the other day, there's a screen there at the register now. These employers that are implementing these solutions that the CDC and the DECD are recommending, I think those are the employers that are ahead of the game. So stagger shifts, creative scheduling, think about what you've been doing in the past and think about how you can be flexible to make sure that your employees are safe, make sure that the public is safe, and that you're minimizing any risk of contraction of the virus and spreading the virus. Sal, do you have any points?
Can I add one point? Yeah, actually, I have one point on the plastic screen issue. One of the ways I'm thinking about this when I'm advising clients is, what if I were the employee in that workstation or in that situation? And so office environments, for example, those of us fortunate enough to have offices that close doors, the Connecticut guidance says that if you have an office, you can take off your mask. Okay, so I can be sitting there for 8 hours in my office with my mask off. What about my secretary who's in a cubicle that does not have a closed door, that does not have walls around it, or works outside what about that person? And how would it feel to be her wearing her mask all day because she's not in a closed environment? What can we do about that? And so those are some of the things we're thinking through. Are there empty offices available? Can we put up plastic shielding to close off their offices, their cubicles, such that would that work? Would that be sufficient under the guidelines? That's why I'm saying, I'm sort of getting into this at such a granular level, and I think HR professionals have to do that because, we live in the workplace. So everything, that we have to do, how are we going to keep the bathrooms clean and ensure that in small bathrooms there's social distancing, and all of these kinds of questions, the lunchroom, everything. I think we just have to think it through, how do we go about our days? And how are we going to have the workforce, social distance when everybody's impulse is going to be, oh my gosh, it's so good to see you. I want to give you a big hug, I missed you, And so it's just an interesting idea to think about it and how it's going to play out. I was even thinking, do we treat our office space like Stop and Shop? Do we put one-way, markers down the hallways that are very narrow? Do we, show people what 6 feet apart is? Because I can tell you there's going to be social distancing creep once everybody gets back into the office.
Right.
I truly believe that people are going to forget about what six feet actually looks like. So how are we going to try to do this with, visual cues in the office space that can help people?
Right. Yeah. Let's go to the next slide because that has some of those considerations as well. So Sal, go ahead.
Well, yeah. So I want to mention something regarding teleworking. Okay. And yes, it does appear to have worked for under the circumstances we're dealing with now. But I don't think it's necessarily been ideal in all situations. I do think we need to encourage it. I don't want anyone to force anyone to come back too soon from a safety standpoint. But if we're looking at it from a legal standpoint, as far as whether or not it's a mandatory accommodation going forward, I think you really need to consider why the employee is requesting the telework scenario, okay? Because a general fear of COVID-19 isn't going to be a sufficient basis to allow someone to work from home unless they fall within one of the higher risk categories, or if they're in fact they need to be quarantined, or if they need to be home to care for a child who's unable to go to school because of COVID-19 related reason. And while, for example, age, we were talking about age before. One of the categories of employees who we have to handle with care are employees who are over 65. That doesn't mean you say to the employee over 65, "Hey, I'm sorry, you're going to have to work from home." But if the over 65 employee requests that they be permitted to work from home, then that is a sufficient basis where I think a sufficient basis for them to ask for the accommodation, and one that I think you're going to have to grant, assuming their business can be done from home. Okay.
Mm-hmm. Really good distinction, Sal, between really good distinction between the paternalistic, you have to work at home because you're in a certain category, versus a request to work at home. That's great.
Right. Let's go to the next slide, because we really talked about the issues on this slide. And as usual, we're at the 50-minute mark, and we've still got 10 slides to go. So we might go over for those who have time. But let's go to the next. Oh, yeah, we're on the next slide. Look, I mean, this one we can talk about pretty quickly. Focus on safety, everybody. I'm pretty sure if you're not already familiar with the CDC guidelines and the DECD guidelines in Connecticut, make sure you go familiarize yourself with those guidelines. We're advising employers to not only familiarize themselves as HR professionals or business owners with the guidelines, but to disseminate those guidelines to their employees and to make sure that their employees have access to those guidelines. Don't tell them to go find those guidelines. Send those guidelines out. Send them the hyperlink in an email. Put up a poster. Make sure that you communicate those guidelines, because don't put it on the employee to learn the guidelines independently. You know, we're advising, send out reminders about safe workplace practices. Make sure that employees have appropriate PPE that's necessary and reasonable for whatever line of business you're in. And it's not going to be the same for everybody, but you know, analyze your situation and make sure you have the appropriate PPE. And if you don't, figure out how you can get it. Look at your cleaning practices for the workplace. How the workplace is disinfected. Is it appropriate under the CDC guidelines? We're going to focus on. I'm going to say this a million times. A safe workplace is the best workplace. Not only is it legally required under OSHA, but it's just the right thing to do. It minimizes all sorts of risk, and it leads to happier employees and increased productivity, and it helps with retention. So, I mean, you know, a lot of employers focus on this as a drag, a cost center, and it's not. I mean, these are issues that can really help you in the long run. These are things that you can implement for the long run. These are practices that should stay in place once the pandemic subsides. So make sure that you consider how you can implement these best practices on a going forward basis. So the next slide is just me encouraging everybody to follow the CDC guidelines. And if you walk away from this webinar with one thing drilled into your brain, follow the CDC guidelines, because that's going to be a liability driver going forward if you are not complying with the CDC guidelines. Well, at the end, we'll touch a little bit on the types of litigation that we expect to see to come out of this. But, you know, the CDC guidelines really are the baseline, and make sure you understand them. The hyperlink is there. We're going to be circulating this afterwards. So if you haven't seen that webpage yet, you can just follow this hyperlink and go right there. Just make sure that you understand those guidelines. Tell sick employees to stay home, separate sick employees, educate employees about how to reduce the spread. Make sure that they understand how to take steps to protect themselves. Train your supervisory employees on the CDC guidelines and what to do in your workplace. I mean, these are all very important steps. And I know that a lot of the clients I talk to think it's a drag and they're upset that they have to do this. But I mean, really, you're just protecting yourself as a business. And if you don't do it, you're going to get, there could be criminal summons. I just saw in the paper that one of the local restaurants here in Manchester received a criminal summons because it was running, it was open to the public in a very hush-hush type of way. And the police caught on to it and issued a criminal summons to the restaurant because it was allowing patrons to come sit at the bar. And so, don't do that. I know that these are desperate times and people need money and they want to stay open, but getting yourselves in trouble with the state or with local law enforcement is not going to help that. And believe me, local law enforcement's looking out for it. I don't know what the upshot's going to be ultimately and what penalties will be in place, but local law enforcement has been instructed to keep their eyes out on entities that should not be conducting business with the public or that are violating current safe workplace rules. Workplace practices during the pandemic. One thing we talked about, and this is the next slide, is mandating employee temperature taking. Yeah, it's okay. 100.4 or more or above, send them home. 100.4 or above is the Connecticut recommended. That's the breaking point. If it's at 100.4 or above, send them home. Look, is temperature taking a panacea? No, it's not. Is antibody testing a panacea? No, it's not. One of the questions that we got in while we've been talking is, can we as employers administer COVID-19 testing? I do not think that's a good idea. What you can do is I think temperature taking on a regular basis is a very good idea. And I think it is indefinitely until the EEOC tells us to stop doing it. I think what you do is, for employees who are sick or who have been exposed before they return to work, make sure that they get a doctor's note. And that is perfectly legitimate under current EEOC guidelines. You can get a return to work note, the fitness for duty note. If you're not happy with it, if it's not sufficient, send them back. Make sure that you get sufficient clearance for that employee to return to work. Testing's hard enough to get as it is right now. You're not going to get testing. You don't want to be administering tests.
Let me just make a distinction here between what the EEOC, as you know, said and what we advise, right? So we know the EEOC said employers can issue or can do COVID testing on their employees. That's what the EEOC says. Right. What you're saying is, think of all the risks involved with doing that testing yourself as an employer. And so one thing that is possible if you have the money is to hire a third-party testing organization, or, to your point, to require testing. The employer, don't you think, can require? What do you think about that? The employer requiring a COVID test prior to an employer reentering, right? So, but we're saying,
acceptable.
Yeah, go ahead.
Right,
go ahead, Sal.
but it is acceptable to the extent that they can get the test. I mean, even with the return to work certification from a doctor, the EEOC says it's perfectly acceptable. OSHA says it's recommended. But they also take into account the fact that it might not be possible. Just as it wasn't in the beginning of the crisis when people were applying for paid sick leave, it was under the paid sick leave under the FFCRA. It was understood that, look, you might not be able to get a doctor's note. So what you have to do is come up with an alternative. Maybe have, maybe go to a clinic or a pharmacy or somewhere where they have healthcare providers who are able to provide this service. Now, another thing that they're also recommending at the EEOC, if in fact you can't get a doctor's note, is to self-certify. I don't like to rely on self-certification, claiming that I haven't had a fever of 100.4 in 14 days, or I'm not coughing. I think that's tricky. Okay, I think that's tricky. But the EEOC and OSHA are basically saying, look, you might not have a choice in certain instances, but to accept that you need to be flexible. And I guess that's really what it's about at this point. It's about flexibility.
Yeah. So let's move on to the next slide, because we're out of time, but I'm going to keep going because I like a lot of these slides about managing during the pandemic, and to the extent that anybody can hang on, and I just like to hear us talk about it. So we're gonna keep talking for probably 10 or 15 more minutes, and we do have some questions. And I have the time to stay on, and I think this is important stuff. And so what about, and Sal, you raised this question, what about employees who are scared to come to work but aren't symptomatic and haven't been exposed?
Right, right. So what OSHA has given us in terms of guide, and by the way, this is a huge issue. Employers call me have big issue. I've had clients call me saying, "Hey, look, this person's scared to come back," and some clients have even said to me, "I really want to help them out." And but here's the problem with helping them out by allowing them to continue to get paid. Ultimately, the employer or you as the company are going to have to maintain records justifying why you permitted an employee to go out on paid sick leave or on enhanced FMLA leave. And I've advised my clients on the record keeping requirements because it's a possibility. Do I think it'll happen? I really don't know. But there's a possibility that the IRS could come back and say, "Hey, remember all those tax credits you took? Where's your paperwork that supported your basis for paying out benefits?" So, and I think from a PR standpoint, it's important for an employer to let the employee know, "Hey, look, as much as I'd like to help you, and I get that you're scared, really, I can't continue to pay you while you're out." So OSHA says that if people are scared to work, it has to be that they reasonably believe that they are in imminent danger. And this is what I was talking about before. Generalized fear. I mean, we're all afraid of the virus, right? But generalized fear is not enough. It could be acceptable, OSHA says, and it could be legitimate, the fear or the generalized fear, if you're dealing with people who have an underlying medical condition, or for example, people under 65 who have an underlying medical condition, people over 65 in general, pregnant people, people who have some of the other markers that would indicate that they're substantially at risk. Those are reasonable beliefs of imminent danger. But beyond that, employees, look, we all want to stay home, I guess, while this is happening. But like things have to go on, business has to go on. And so I don't know that there's much you could do. Now, I just want to mention one more thing. OSHA is permitting, in terms of employees who've been exposed to COVID-19, when you're dealing with critical infrastructure, okay, and essential workers, OSHA is recommending that asymptomatic employees be permitted to work as long as there's regular monitoring to make sure that they're not exhibiting any symptoms that would indicate that they've, contracted full-blown COVID-19. So that's something else that's something that we really need to consider. Matt, you want to add something to that?
Yeah, well, on this slide, I just wanted to quickly point out hiring and onboarding issues, which I haven't heard that much about from clients, but I do think it's important to note that employers can screen applicants for COVID-19 symptoms, but only after making a conditional offer of employment. And if an employer is going to screen applicants for COVID-19 symptoms, you got to do it across the board, or else you're going to get yourself into discrimination issues. You cannot make an adverse employment decision based on COVID-19 risk factors, such as advanced age or pregnancy, like Sal said, but you may make reasonable accommodations, such as teleworking for those individuals. If an employer requires that an individual has to start work immediately, but the employee is unable to do so because of COVID-19, the employer can rescind the job offer. So, look, bottom line there is issue spotting. If you are going to require COVID-19 testing prior to offering employment, make sure it's after a conditional offer of employment. You do it across the board. But I will also say you might want to talk to your in-house or outside employment counsel before you implement this program, because there are a lot of red flags that you could really raise some liability here. We talked about fitness for duty documentation when a sick employee returns to work. So we're gonna go to my favorite slide in this presentation, which is the next slide. What about COVID-19 fakers? What can you do?
You're like a cop, Matt. You're like a cop.
Hey,
You're
look,
a cop.
It's a real thing. There are COVID-19 fakers,
Right.
and don't take my word for it. The FBI is advising
Right.
businesses that employees are faking positive diagnoses and using fraudulent medical documentation. This can lead, the example I use here is that this can lead to expensive remediation costs. Tricia, Sal, and I talked about this. The disinfecting costs for COVID-19, and when one of your employees is sick with COVID-19, can be astronomical, tens of thousands of dollars for deep cleaning remediation. And if you have to do that because somebody faked it, man, that's a tough pill to swallow. It can also lead to lost production because of the closure of workplaces or departments, and obviously PTO for fake exposed employees. So what do you do? I mean, that's really the question. What do you do? Well, look, terminate if you can confirm. Do not issue discipline. Terminate. Do not put up with fakers. But the problem is, how do you confirm that somebody's a faker? Well, there's no magic silver bullet here, but look at medical letters. See if the letters appear genuine, or if you have reason to call into question that they were forged, or that the format or structure is strange, or something's just off about it. And if so, ask for clarification. You can contact the medical provider to authenticate the document, but only do that after first providing the employee an opportunity to authenticate the document. Look for computer-generated signatures versus wet signatures. Look for just weird stuff on letters from medical professionals that you just wouldn't expect to see there. Misspellings, diagnoses that just don't make any sense. Fake medical providers. Look up on the internet to see if the medical provider is actually a real person. Don't just take the employee's word for it. It's not that there's no one solution to identifying the faker, but if you have a reasonable basis to believe that somebody's a COVID-19 faker, keep an eye out for it. See what, listen to, try to look at the medical documents. Try to see if you can figure out how to confirm that the employee is faking. And if so, terminate, because it can lead to huge costs. So I just like to talk about that because the FBI is actually advising businesses, and it's a real thing. I gave webinars where people didn't believe that it was a real thing, but whenever there is chaos, people try to take advantage of it, and there are bad actors out there trying to take advantage of this chaos. So make sure to look out for it and protect your entity. Next slide is, what can an employer do with an employee that won't answer questions about COVID-19 symptoms, test results, or have their temperature taken? Sal, Tricia, do you want to take that question?
Sure. I mean, one thing, this is really interesting. Have not had this come up, but I've had this come up in other contexts, like vaccinations. What if somebody has a religious objection to it? That I have not had that come up, but I would say give us a call if somebody's claiming that they have a religious objection to having their temperature taken, but I'm not sure that would fly in this pandemic environment. So you can bar their physical presence in the workplace, but again, ask why they're refusing. And, if it has to do with job security, then, you can explain to them, no, it's not about job security. And in fact, they should have their temperature taken in order to have to ensure job safety for everybody. Okay, let's move on to the next one. Okay.
Can you ask about associational
this is interesting. Yeah, this is an interesting, I'm glad the way you framed this is interesting, because it would be the normal question, do you have any family members infected? But you don't want to talk about it in terms of family members. You want to talk about it in terms of, have they had contact with any infected people? So don't limit it. Don't talk about family per se. Just talk about, have you had contact with anyone who has tested positive with COVID-19? And why?
Yeah.
Because there are laws against asking about family medical information. So it's even a better question to ask it more broadly. Okay, next. Okay, so what should
this is a tough one.
Sorry, yeah, right. Okay, so what do you do if an employee has tested positive? And I do think the guidance, Matt, has changed over the course of the pandemic in this regard, because it was more severe about what the employer needs to do early on, and then it was realized that the guidance early on could result in nobody ending up in the workplace. So in other words, I think, so right now it's, do people who were potentially exposed have to leave? It used to be, yes, they should be made to leave. And now my understanding is if you are, let's say, working on a floor and the foreman of your group has tested positive, does that mean, and you know that you might have been working 6 feet away from him, does that mean that you as an employee also have to leave the workplace? And my understanding is the answer is no. As long as you are not exhibiting symptoms, even if you've potentially been exposed to somebody who has COVID-19, you could still come to work unless and until you continue to have symptoms. Matt, is that your understanding of the current guidance?
Yeah. Yep, I agree.
Okay, and then what about deep cleaning now under the circumstances where, a manufacturing facility has someone who's tested positive? I don't think deep cleaning is required for the first positive test case of a COVID-19 employee on a work site. What is the current guidance on that?
Yeah, I mean, I think you have to analyze it on a case-by-case basis, and if you were able to isolate the employee and trace the employee's movements, and it might not require facility-wide cleaning, as opposed to if the employee was everywhere and was in contact with everybody, it might be the better idea to do a deep cleaning. And I think it also depends on the type of facility that you're operating and what's at issue. If you're processing food products, you probably want to do a deep cleaning and do sufficient disinfectant. If it's an office environment and the employee was really located to a discrete area, it might just be that you do a deep cleaning on that office or the hallway or the bathroom. But it's the kind of thing that you need to take into consideration all the facts and circumstances and make a determination about what's reasonable. And often the questions of how we deal with these COVID-19 issues is what's a reasonable proportional response to the issue that we're dealing with. Because a lot of the questions don't have clear-cut answers.
And still, even with a positive tested employee, you don't broadcast the person's name all over the facility, even if it might possibly get out. So, yes, people who need to know. People who might have worked with this person don't necessarily need to know the specific name, but they would need to know it's possible that you've been exposed, or we've had a person tested positive. You might have come in contact with that person. However, at this time, we're not requesting that you stay home. We're just requesting that you self-monitor. I mean, people are going to want to know, and the rumor mill will start, but it shouldn't come from the employer in terms of the actual name.
That's right. Don't let your fear of people figuring out who it is prevent you from doing your due diligence in letting people know that they might have been affected or
they have
exposed.
to know they might have been exposed. Right. But,
and I do want to make one. I just want to make one quick point. I've been talking about OSHA and some of the points that OSHA raises. I think it's a good idea for employers to essentially look at what their guidelines are depending on the risk factors associated with your business. Certain businesses are considered low risk, some are considered very high risk, some are considered medium risk. OSHA has some guidelines for each category that makes recommendations on what it is that you should do. And again, nothing is foolproof, nothing is 100%, but I think you're on safe ground if you're at least following what the recommendations that OSHA is putting out there.
Yeah. So let's go to the next slide. And this is something we pretty much addressed this. Can you exclude healthy older people from work? And remember, older people is 40 or over under the Age Discrimination and Employment Act. And, I don't really consider that to be old, but some people, federal law does. So can you exclude healthy old people from work? No, you can't. No. ADEA still applies. You can't exclude people from work based on underlying conditions being a potential risk factor, and age can be a risk factor. So you can't base them on age alone. You can't ban people from the office based on age alone or any other protected category, really. But if somebody's sick or is symptomatic or has been in contact with somebody that's sick, that does the trick. Then you can keep them from coming to the workplace. So the next slide is what in line with that previous slide. What are an employer's obligations when an employee has a disability that could put them at risk? Verify the disability, and if the accommodation is needed because of COVID-19, assess whether the reasonable accommodation. Assess whether it's reasonable in the first place, and if it is, whether that reasonable accommodation will cause an undue hardship, or I'll also add pose a direct threat to other employees or clients or customers. In verifying, we've talked about this. Remember, doctors are busy. EEOC recognizes that as well and has urged other methods of return to work and fitness for duty tests. Do what you can to get a verification, but remember, EEOC is urging that you not require a doctor certification. They're looking at other ways of verification, and to the extent you have a question about that, talk to your HR department, talk to your counsel, because these are some of the more tricky questions that could get you tied up in some discrimination risk.
Right. Can I say on that? I want to add to that point, Matt. This is really a really difficult question for those clients of ours in healthcare and long-term care because many of the employees may have an underlying condition that might make them more susceptible to being more ill if they contract COVID. And yet these employers also have to maintain their workforce. And so this is why we have to take these things really on a case-by-case basis. And your last point there is there an interim accommodation? Can we take this step by step without promising something in the future? Because if someone's saying, I can't work with COVID patients because I'm concerned about, catching the illness, and here's a doctor's note saying that I should be concerned, is that sufficient for me to be kept away from COVID patients? Well, one of the factors there is going to be how burdensome is that to the employer, or can we do this on an interim basis? Like right now it's okay, but we can't promise that, 5 months or 5 weeks from now it's going to be the same situation, or can we offer a different accommodation, like you can take a leave of absence instead of not having to work with these patients. So there are a lot of specific things that we can talk about, and it all depends. It's very industry specific as well.
That's right, and I want to make up one point as well, and the EEOC has addressed this. When you're dealing with undue hardship, you look at whether there's significant difficulty or expense. What may not have constituted an undue hardship 4 months ago could possibly result in an undue hardship today. And one of the examples they give is, for example, if you're dealing with an employee who can't wear latex gloves, right? And they require alternative to latex gloves. That doesn't sound like a significant difficulty, but in fact it could be under the circumstances now, because it's impossible to get anything delivered, as we all know, as we wait for our Amazon Prime packages to come on a daily basis. So you have to take those things you have to take all of that into consideration. What may have been a significant, what may not have been a difficulty before, the EEOC recognizes it could be difficult now. So again, case by case, and you have to look at the context.
Okay, so we're going to move to the next slide, which is what's next? A lot of litigation. We expect to see lots of wage and hour litigation, leave law litigation, FFCRA, but also FMLA litigation, disability litigation, age discrimination lawsuits, safety accusations. There's going to be a lot of litigation coming out of COVID-19, and just, be aware that that's going to happen. That's why we need to do our best to take reasonable efforts to maintain safe workplaces, to comply with FFCRA, to comply with wage and hour laws. And that's going to be a huge driver of litigation, not only individual wage and hour litigation, but class and collective action litigation. So issues like when you do a temperature check and you require employees to wait in line, do you have to compensate those employees for that time that they spend waiting in line to get their temperature check? I would say yes. Pay them for that time, because I think that goes. It's a lot like donning and doffing laws, where do you have to pay them for the time that they wait? That employees are required to put on protective, PPE. But those are going to be very difficult questions, and there's going to be a lot of those questions coming out of COVID-19, because there's going to be a lot of unanticipated consequences of the practices and procedures that we put in place. Didn't have any ramp-up time to get prepared for this. That's just the bottom line. So there's going to be a lot of litigation. A well-planned return to work. Well, that might help mitigate your risk on litigation. If you you have a plan, you get a proactive plan for returning to work, and you implement it in a thoughtful and thorough way, instead of just saying, all right, everybody get back to work, and then deal with it as it goes, because that's going to be where you see a lot of problems. And as Tricia said, we're working with a lot of our clients on return to work plans. It might just be a brief 2 or 1 page bullet point summary, but that's better than nothing. Understanding the segments of your workforce, how they can work, where you can be flexible and where you can't be flexible, what the timelines will be, staggered returns, different types of scheduling. Do you have a union? Do you need to talk with the union about return to work? Is there decisional bargaining or effects bargaining about some of the flexible arrangements that you might put in place? But these are all things that you need to think about, and you need to think about them proactively. And making sure that you talk to the different stakeholders in your organization that can give you input on what might be helpful for them. A thorough, well-planned return to work is going to help reduce your litigation risk. Setbacks. There's going to be setbacks. I think that everybody can agree there's probably going to be another wave of COVID-19 if we don't get the vaccine in place relatively soon, or some sort of treatment for COVID-19 come the fall. Say everybody goes back in June and July. Come the fall, you might be sending everybody back home, and we might be back to square one if there's another surge. It could be even worse than the first time around. I don't think any of us are qualified to say at this point. I think a lot of it depends on the timing of a vaccine and the treatment. There's promising news about a vaccine, but those tests take time. With polio, the polio vaccine, when that was first administered, there were a lot of deaths because it takes time to work the kinks out of the vaccines. So be prepared that this is going to be a 1 or 2 year long process. And that's why we're talking about being proactive and planning every stage of returning to work, and contingency planning for second waves or third waves of the pandemic, or just future pandemics in general. Now's a good time to start thinking about pandemic planning for the future. More federal relief, state executive orders. I assume there's going to be more federal relief on the way I hope there's not another FFCRA. I hope there's more clarification on the outstanding issues that we're dealing with, or the fuzzy issues. State executive orders, yeah, I'm sure there will be more of those. Will they impact the workplace? Probably. So make sure to stay on the lookout for those. How can you do that? Well, you can sign up for our, here's our shameless plug. You can sign up for our Murtha employment law blog. Sal, Tricia, and myself have been updating that regularly, 1, 2, 3, 4, sometimes 5 posts a week, trying to stay on top of all the most important issues for our client base, and more webinars. I expect that we will have part 3 probably in another month, because I'm sure that there will be a lot of changes within the next month, and hopefully they're positive. Positive thinking is what we're trying to practice here at Murtha. Prepare for the worst, but hope for the best. I know that just talking to a lot of you that are our clients, the mental strain is real for everybody, including us. And I think a positive outlook and taking care of yourself goes a long way to making it through this. So I hope you're all able to stay positive and to take care of yourself. If you have any questions, we didn't really get a lot of questions today. I'll talk about, and there's our resources slide. We updated that a bit since the last time we sent it around, so that'll go out. One question we had is about the $600 supplement for unemployment insurance. Does that apply to everybody or only individuals impacted by coronavirus? Practically speaking, most of the people that are on unemployment right now are because of coronavirus. So most people, even if it were only for coronavirus people, it would be like 99% people get it. But my understanding is that if you get $1 or more of unemployment insurance benefits in a given week, you get that $600 supplement in that week for whatever reason.
Matt, let me just interject. People are being required to self-certify that their inability to work, and I say inability to work because it's not just terminations, unfortunately. It also has to do with reasons that, like the enhanced FMLA provides, which is staying at home with a child as a result of a COVID-19 closing. There are 10 categories that you have to and you have to certify under one of them, and it appears that they all relate to COVID-19. So I think presumably, as Matt said, generally speaking, that's what it's going to be anyway. But an employee is still going to have to certify that it is because of a COVID-19 related reason.
Yep. One other question we had, I think we addressed most of the other ones. There was one that said, one question was,
there was one about a healthcare facility, right?
And this doesn't even have to be specific to a municipality, but this one said, as a municipality, can we have our health department perform the testing in-house? As an employer, sure. You can perform the testing in-house if you have that capability, but you have to make sure that you set up the testing in a defensible manner so that you're protecting confidentiality and that the testing is reliable, and that it's not overly invasive, that you're not testing for anything other than what you're saying you're testing for. There are a lot of unanticipated issues that go along with in-house testing. So I would work with your counsel in your HR department to make sure that you're implementing it in a defensible and effective manner. And I can't speak to every organization because, it really depends on your organization and what your capabilities are and what your practices are. But that's why I said earlier, I think it's safer to do it off-site unless you really have the capabilities in-house to do it, which you can, but you got to make sure that it's defensible because this goes back to a wave of litigation. We're going to see a wave of litigation. Plaintiffs' lawyers are going to be circling to see what they can latch on to. And employees are going to be desperate because a lot of people are unemployed. A lot of people need money, and that's not going to end anytime soon. So you might think you're doing the right thing and you might have good intentions, but the old maximum employment law is no good deed goes unpunished. So you got to make sure you have defensible procedures and policies in place. And if you can't do that, just do it outside. Do it out with a third-party vendor that you trust and that you know is going to handle it in a defensible manner. So I think that's it for questions. If anybody else has questions, well, you can go to the next slide because I have my questions slide. We didn't do that, but
you just wanted to show that
questions?
slide.
That's right. Actually, I think that's a picture of me. That's a picture of me eating this morning's breakfast.
Yeah. That's so look, I mean, we answered I think all the questions that were posed to us. If anybody else has questions after the seminar, you know, our contact information will be on the PowerPoint. Most of you, I think a lot of you are current clients anyway, so we're happy to talk with you about any of these issues, of course. And if you're not a current client and you want to explore engagement with us, we'd be happy to talk about that right now. Bulk of all of our practice is focusing on COVID-19 response, obviously. So please feel free to reach out to us and leverage us as a resource and subscribe to our blog so that you can continually get that free advice on an ongoing basis. So, Sal, Tricia, do you have anything to add?
No, thank you all
No.
for your time and energy and focus today. And one of these, I guess we did get to take a couple of questions, so that was our goal for the day, even though it wasn't within the hour. So thank you, everybody.
Right, that's right. It took a little longer than necessary, you know, but otherwise it's good.
All right. Thanks, everyone.
Next time we'll plan an hour and a half.
Thank you.
Take care, everybody.
Okay.
Right,
all right.
right,
Okay.
right.
Bye.